Now, from digitizing patients' records to having patients seeing their doctors virtually and much more are some of the fruits of the decade-long journey of healthcare under devolution. The journey has not been devoid of challenges, with counties still grappling with low public health insurance uptake, lack of sufficient medication, healthcare infrastructure, and healthcare human resource shortfalls. Ahead of the Nation Media Group Summit, NTV's Health and Science reporter Bridget Ghana looks at how different counties are pursuing universal health coverage and how these devolved units are navigating the funding cuts under the United States Agency for International Development Funding, USAID.
So far, group comment.
An online conversation that on the face of it could be thought to be a work meeting, but it's not work. It's a medical appointment. 23-year-old Joseph Karanja speaks with a clinical officer during his diabetes review clinic through a tablet in this room at Sabasaba Health Center in Murang'a County. Joseph lives and works in Bomet County and learned about his diabetes diagnosis a year ago.
Kulikuwa tu jioni, mimi nikafunga kazi yangu, nikaenda tu kwa nyumba. Asubuhi kuamka naona bado sioni kitu. In fact nikiamka ile kizunguzungu inanipeleka ni kama tu nitaanguka. Nikaangalia nikasema hapana. Nikachukua hata sikuenda kwa chemist, sasa nilienda Rogesa hospitali. Kwenda pale wakaniandikia tests, lab tests. So nikaenda nikafanyiwa zingine sikumaliziwa. Nikaangalia nikajiuliza kuna mahali najua my mom huwa naenda na tibiwa vizuri. Sasa that time alikuwa naenda Maragwa. So nikasema heri nitoke tu huko, nikuja na huku, nikuja nitengenezwe.
And when he returned home to Murang'a County to get assistance, he found telemedicine taking root at the health center in his village. He has never met the medical officer handling his case in person.
My mom pia ni anakuanga na hii ugonjwa ya sukari. Akaniambia kuna mahali mimi huwa naenda, nilishakuwa registered already. Sasa ndiye akanileta hapa, ile kutibiwa yote nimetibiwa. Hiyo ya telemedicine ndio imenisaidia. Juu nikikuja hapa sukari yangu ilikuwa inaanguka chini kabisa. Ilikuwa inafika hata unapata sometimes iko 2.9, lakini toka nikuja hapa tukaanza kuimoderate vizuri sasa ikienda chini sana it's 4.8 4.7. So naona at least nimesaidikia mahali hapa. Kama ni dawa nikaona si costly kama venye zilikuwa hapo mbeleni, maana hapa nikikuja napata sometimes dawa yenye nilikuwa nanunua kutoka 1k nanunua either for 90 ikienda sana ni 500. Tena nikikuja hapa consultation fee is just 100 bob. So nikikompare na pale mahali nilikuwa naenda, ndio unajua ndio uone daktari ile mkubwa lazima ulipe about 500. Lakini sasa hapa naona ikiwa more cheaper. Sijui mahali yako maana tu mimi namuona tu tunaongea tu, lakini bila ananitibu ni kama mwenye tuko na yeye hapa.
The health worker Joseph has been seeing sits nearly 40 kilometers away at Muriranja Sub-County Hospital at the county's telemedicine hub, where, at the touch of a button, doctors and other specialized health workers attend to about 15,000 patients with chronic illnesses. So apart from digitizing its health records, Murang'a County has begun implementing telemedicine. And this means that patients who are in far-flung areas are able to access specialists through the internet. Here at Sabasaba Health Center, patients with chronic ailments like diabetes also get to see their specialists on a monthly basis.
Mostly we deal with chronic diseases. So if you go, for example, to Molanga River 5, there are so many patients who are seen on clinics. So there's big queues. Clinics, they're given very far, maybe they're given 6 months. So you see, if you give a patient 6 months follow-up, not all of them will be able to maybe do weekly BPs, weekly blood sugar. So this telemedicine, at least we're able to give them a shorter duration of clinic.
Every meeting, mwomba bwana gavana akanyangia hapo. Na ongeze madawa, sababu madawa ndio shida. Utakuja hapa utibiwe uambiwe uende ukanunue dawa.
Quality universal health coverage involves affordability, accessibility, availability of services. If you are able to take care of that, then you are going to reach the people. The biggest challenge we have in the region is diabetes and high blood pressure. Those are the diseases that fill up our wards. Those are the diseases that consume a lot of our drugs in the hospitals. We have gotten a very big challenge managing these diseases, and that is why we brought up telemedicine. Telemedicine services are available in 36 of our facilities. These are facilities spread out throughout all the wards. These are patients who are able to be seen through a computer screen, and they are able to consult a doctor from the other end, right from the comfort of their village.
Murang'a is the only county that now boasts of nearly fully digitizing its health records systems and revenue collection at all health facilities. This means that the county government can finance some of its recurring health needs.
The level 5 hospital used to do about 100 to 150,000 shillings a day, cash collections. A few weeks after we automated our services, this money tripled to almost 500,000 per day. So we were able to reduce the losses simply by automation. So the revenue of the hospitals has actually improved markedly. We have a total of 162 health facilities. They are all interconnected now. So we are able to communicate between the various levels of care.
Definitely labor unrest has been a major issue. Often it happens at the national level, but then it percolates here. The doctor strike, the clinic officer strike, the universal healthcare staff strike. The strikes have not been very biting in our county. We can only say thank you to our staff for having that humanity. But one major complaint by striking medical staff in Kenya is overload. Critical sectors like health, they still need more manpower. And so therefore the county innovated the idea of internships. We give opportunities to young graduates of medical schools to come with us and learn some skills. And often we usually absorb them after the end of the year internship period. See this one? Coughing is number 1. Yeah? You can pain is number 2.
Digitizing the healthcare network in Murang'a provides real-time data on what ailments people are presenting with at the hospitals, what services have been offered, and how much each facility has generated.
3,000 or whatever. For sure, itself about 1 million. These are the lab tests done today. These are the imaging done today. Yes, we are happy we have automated, but we are not there yet. We think at a certain point in time, once we accumulate enough data, we will definitely pivot towards artificial intelligence. So that, for instance, we get an alert when the drugs levels, stocks are down. We can monitor when an epidemic is about to erupt, because the system is able to tell you today how many people came to our facilities and for what diseases. So you're able to take remedial action. The other one is to understand where do you need to stock drugs and what types of drugs. Before we couldn't be able to make that decision. It was not evidence-based. It was pure conjecture and guesswork. Best healthcare system treats people before they come to the hospitals. If you allow people to come to the hospitals, the systems just collapses. Yeah. So we have been able now to do disease mapping in terms of the regions, also to talk to CHPs, integrate CHPs into our healthcare systems.
We then head west to Kisumu County. This is where the primary care network, a pillar in the process of attaining universal health coverage, was first piloted in the country.
Vitamin a day. Vitamin a day.
One such facility is the Nyalenda Health Center, where mothers and their children are currently undergoing a health education talk on proper nutrition during pregnancy, after pregnancy, and even after the child has been weaned.
Angalau nimeweza kupata masomo zaidi. Kuna yale sikuwa nimejua lakini nimejua. So tumeambiwa wakati tumeshika mimba, kwa hiyo siku ya kwanza tuanzishe kliniki na tuwe tukimeza dawa za kuongeza iron like IFAS. Na pia tukule jinsi pasavyo. Tumeonyeshwa jinsi namna tunaweza pika omena, na omena inatupa calcium mwilini.
We know that in our community, we have very many mothers who have young babies below 2 years. And we also have a number of expectant mothers. We thought it wise to just bring these mothers together. We learn together with them how to make the ideal food. I might be making sukuma wiki in my house, but the way I cook it, I lose all the nutrients. Or I make porridge for my baby, but the way I've made it, it loses the value. That is why we called them here, just to learn how to make the locally available foods.
For Kisumu County, nothing speaks of universal health coverage than this health facility. We're at the Nyalenda Health and Wellness Center, and the wellness part is something new that the county government has introduced across all the health facilities in the county, because apart from screening for chronic diseases for prevention purposes, they're also looking into the mental wellness of the patients.
Wellness, it basically means that I don't have to be sick to come to the facility. I want to know my state of health as it is. I want to make sure that my blood pressure is normal. I want to see to it that my blood sugar is normal. And my weight, when we take the weight, then we are able to calculate for you your BMI and advise you accordingly. We want to get out of this culture of I only come when I'm unwell. I want to see you when you are not suffering from any disease, so that we can be able to identify early in case there is anything, or advise you accordingly on how you can maintain your health.
We like talking about indicators, and maternal indicators are the best way of looking at a health system. I think this is one of the counties where maternal mortality is reduced by 30%. Nobody ever did it. Kisumu was amongst the counties with high maternal mortalities in this country. Now Kisumu is below the national average, which means then we've been able to drastically reduce. We've also been able to increase our surgical packages. You say universal health coverage is not something that you can say you're going to achieve within now. So it is continuous improvement on what we want to do. We have to look at all the pillars of health system strengthening, starting from the human resource. We used to have so many strikes in this county. We decided that we need to sort out the issues of human resource. Community involvement in terms of making sure that they are inside the community committees to be able to work with the facilities in order to improve their health, so that health goes back to the owners in terms of the people. The people's involvement was very important for us.
But in the wake of the USAID funding cuts, Kisumu County says it has begun looking into ways to cushion patients who directly benefited from USAID programs.
Kisumu is one of the counties with the highest burden of HIV, and so the stop work order definitely will affect Kisumu. It is too early even to say what impact is going to be there, because you realize this thing has come at a time when we have enough stocks of medicine up to September. Some of our staff were already on the ground, that they were given another 90 days to work. And we tried to incorporate the HIV clinics into normal service delivery, so that when you are coming for your HIV care, then you can just walk in and be seen by a normal clinician. There's a serious impact which is going to be there in terms of reproductive health, because family planning was majorly supported by the donor world and the US government. So that is going to go. We have very high-risk people we know account for the newest HIV infections. These are female sex workers, men who have sex with men, and we used to have special clinics for these people so that we reduce the transmission. Now, that's some of the things which have been stopped by the US government, and they'll no longer receive funding. So we have to find a way of incorporating them. This is going to be very difficult for the country, because when we take them back to general population, because we have been treating them specially, then we have at higher risk of increasing the number of new infections. And we are alive to that. And this is a discussion that's going on even nationally. How do we take up this role that used to be taken care of by partners?
Yes, Emergency Operations Center Kisumu, how can I help you?
Kisumu is also the county that has a 24-hour emergency response unit that ensures emergency cases, even in the most remote parts of the county, get attended to. Residents have a toll-free number to call whenever there's a medical emergency.
We have around 17 ambulances in Kisumu County, and we don't pay for those services. That is the governor's policy, that this kind of services should be free. But the ambulances are stationed within those facilities. So to make it easier for those kind of services to continue, it was felt necessary that we should have a central unit which controls the fueling of these ambulances.
Laikipia County, World Health Day celebrations were marked in Maina Village, where a free medical camp was organized by the county government. This area is home to hundreds of residents living in the Kwamaina informal settlement, most of whom are yet to register for the Social Health Insurance Fund, SHIF.
Unajua sisi ni watu wa kwazo kolemia. Sasa unajua mtu akienda kibarua ya 300, utaenda 300 ulipe watoto au utalesha. Kusema kweli. Sasa tuko na uzito huo. Tupunguziwe hata hiyo 300 hiyo 200. Ndio tuko ukienda kwa 300, 200 utumie 200 labda upeleke kwa SHA.
Watu wakienda hospitali wasitishwe pesa, SHA inawasimamia. Juu saa zingine watu wanaenda kama hawana, unaambiwa ulete pesa, SHA haikusimamii, unarudi bila matibabu.
When we used to have NHIF, there is a time we were the best in the whole country in registration of NHIF. We want to buy almost similar ideas. And a lot of mentality has been put into people's minds that SHA does not work, SHA cannot work, SHA is not important. But we all know where we are, even globally, we cannot be able to afford health without a form of insurance. Then we have to do a lot of sensitization. We have to show them practically how is it helping. And for sure, people need not to be frustrated when they are seeking for services after they have already agreed to register for social health insurance and even maybe having paid for it. What frustrates people most is when they have done what they are supposed to do, but then they are not getting the services.
According to the Laikipia County Executive Member for Health, the inconsistencies in the disbursement of insurance claims from SHIF are in part to blame for the low uptake of the national health insurance.
Whatever is ailing us at county level, it is not of our own origin. If the national could be able to correct all the messes, including payment of the debts they have for NHIF, like for example, Maina Health Center, if at all they have been able to claim, they should be able to get their money into their accounts. Now that we have Facility Improvement Fund account in every of our facility, there's none of our facility without that account. But most of the accounts have no money because we are expecting to get money from social health insurance.
But the County Department of Health says it has increased the number of medical facilities in the county and is looking to improve the quality of healthcare services to the people.
Before devolution, we had about 60 health facilities. Today, we are proud of about 100 facilities. We have about 1,400 community health promoters with about 154 community health units. But when we talk of universal health coverage, is where we are saying, can everybody be able to access health care? And health care starts from preventive, promotive, curative, rehabilitative, and even palliative for those who are in advanced stages, for example, advanced stages of cancer.
In the decade of healthcare under devolution, despite Kenya making significant strides towards attaining universal health coverage, emerging challenges such as the coronavirus disease of 2019 or the COVID-19 pandemic, as well as gaps in health insurance education, could stall the push to have every Kenyan access the full range of quality health services they need, when and where they need them, without financial hardship. Bridget's Ghana, NTV.